Fairfax and Lauralee, have we ever met? No, we've never met. But I so appreciated your question because I asked the same question in 2012 when I ran into Dr. Handler. I'm a food industry lifer. I own restaurants. It's all I've ever done. Everything I've ever had in life has come from food. So I tend to treat it differently, value it differently than most people. And we saw horror stories or we saw exposés on the news where someone goes to a food pantry driving a Mercedes. And the cynic, which is inbred in all restaurant owners, we are by nature short attention span, and we're cynics. We don't trust anybody. And I questioned, were the numbers accurate? More importantly, if I'm going to make an investment in something, I want to know what the return on that investment is. I want the data. And prior to this effort, Waste Not OC, there was never any data. We didn't have accurate data on how many people were food insecure or what that meant. We didn't have any data on where is the food or the money that I give to nonprofit agencies. Where does it go? What is it being used on? So that was our initial goal, was to put together a model that was effective. Run it like a business, not like a nonprofit. And we came up with this effort and this model. And I'd like to just briefly walk you through it real quick. And then I have an ask, and it isn't money.
You have time, Mike.
So basically what works is a public-private nonprofit effort. In other words, we have to have all three of those components together to be effective. If any effort is only run by one of these, the public sector, it's not going to work quickly. It's not going to be efficient necessarily. It's just inherent in what the institutions are like. If it's run by nonprofits, there's other challenges. And if it's run by the private sector, we'll have challenges. But what really works is when all three work together. That's when we're really cooking with gas, pardon the pun. But each one has a role. The public sector has a role in that they have assets. For example, with Dr. Handler's help, we got the Orange County Environmental Health Department, meaning restaurant inspectors, to educate operators about donating excess edible food. For years, as operators, we never donated food, very seldom. Does anybody want to shout out the reasons why I, as a restaurant owner, did not want to donate food? Liability. Liability. That's very good. That was always the first answer. It wasn't the honest answer, but it was always the first answer, and I gave it a lot. What's the other answer? Anybody know? Too much trouble? That's very good. That's also a factor. Distribution, yep, effectively getting that food to where it needs to go. And there was another one that I didn't realize. We all knew it, but I didn't realize how prevalent it was. And that is, we're all companies, and we've spent a lot of money and time and effort building our brands. And it wasn't that we didn't want to feed people. By nature, we hate throwing food away, again, because we value it differently. But we didn't donate because we weren't confident that that food would be handled correctly, and we were scared to death that somebody was going to get sick from that. Liability really wasn't an issue. There was a federal law passed in 1997 that allowed for liability protection. So it really wasn't the liability, it was the brand protection. One perfect example is we went to the Angels baseball. And we had a location at the stadium for years. Our restaurant did catering for Major League Baseball in the clubhouses there. So we felt comfortable going to them and asking them to participate. And the first answer was, absolutely, not a problem. A week later, the chairman of the board comes back, he goes, oh, hey, that food donation thing, yeah, we're not going to be able to do that. And I go, why? You don't have to worry about being sued. And he goes, no, it's just we can't afford for a homeless person to get sick on a hot dog with an Angels baseball wrapper on it because the media will destroy us. They're still ticked off that we changed the name from Anaheim Angels to LA Angels. They'll look for any reason to torture us. It was brand protection. Disney gave us the exact same answer. It was brand protection. So what we did is develop a model that was effective in how it moved food, handled food safety as a primary concern. This is in essence the coalition model that we've come up with. We look at it as almost an umbrella. And that is, we work as the frame of the umbrella, our coalition, meaning we don't compete with anybody. We work with all these 500 plus nonprofit organizations in Orange County that feed people. They are all doing the best work. They are the foot soldiers that feed people. But we help them, we shelter them, and we help augment what they do by bringing in other partners and participants. So we, along with the public sector, have a role to play. You'll see environmental health inspectors, as we mentioned, the food banks and the food pantries that do the work, the food industry. So for years, we're trying to solve hunger, and we pretty much ignored the food industry. We didn't speak the same language, and then we wondered why they didn't respond to us. So we look at healthcare providers as another example. What we're providing are solutions for and cost benefits. Because again, I as a restaurant owner, okay, charity is great, and there's a time and a place for it, and we can afford a certain amount. But if there's a cost benefit, I'm more interested in participating. And I can also justify participating. And then waste haulers were critical for us because most of this excess food becomes waste. Everybody still with me? All right, thank you. You've gotten further than my family usually gets. This is what we do. Two elements to this, the food recovery side of it and the food insecurity side. So we'll start on the left. We're going to work with the food industry in basically getting them to donate food, identify where available food is, and be able to get that food to where it can serve people. The way to do that is by providing food safety, the next item on there, best practices. So for example, of those 500 nonprofit food pantries, sounds harsh, but many of them need to go away. Not because their hearts aren't in the right place, but they're reliant on volunteers, first of all, and they are not food service professionals. So many times we're compromising food safety, public health, when we are trying to do the right thing. What we tend to do is provide them with the expertise, the experience, the equipment, the ability to improve their capacity and be more efficient and effective in what they do. The logistics capacity. So what is logistics? It's getting product from point A to point B. If you ask those 500 nonprofit pantries in Orange County what they need on the top of their wish list, they'll all tell you the same thing. We could really use a refrigerated van. Well, now we have 500 refrigerated vans crisscrossing the county with no rhyme or reason, and it's a logistics nightmare. What we've done is develop a platform, a technology platform, that allows us to identify where food is at. I, as a restaurant owner, will hit donate on my phone. I'll hit donate, I'll identify what the food is, how many pounds, and when you can pick it up, what the pickup window is. It'll immediately connect it with a food pantry in the neighborhood closest by that has the capacity to receive that food. So we've just eliminated so much of the work and effort. It also requires that pantry to acknowledge that they are going to accept that product, so we don't waste time, we don't waste volunteers or logistics resources. And now we get that food from point A to point B, and we track how much it is. We get data, real data. We know how much food has been recovered, where it's going. The other element of this logistics capacity is who's going to deliver this stuff? Do we really need a refrigerated van? No. I just need 4 wheels. I need to just make sure that food is safe. And we have the technology, we have the ability through food recovery materials, basically insulated containers, to put food in it and get it 20 minutes away, 15 minutes away to a pantry that can receive it and hold that temperature, hold that food in a safe manner. That's really the critical component. Great story. Dr. and Handler and I had a meeting with someone as a request, as a favor, to meet with Yellow Cab. And I remember both of us going, that's an hour, we'll never get back. I don't know why we're doing this, but hey, it's a favor. Let's go talk to Yellow Cab. And Yellow Cab comes back and they say, well, you know, with rideshare now, nobody hails a cab anymore. They do contract work. They do contract work with senior centers, airports, et cetera. But our cab drivers are independent operators. And there's lulls in their day, downtimes. And one of them are mid-afternoon, mid-mornings and mid-afternoons. Mid-afternoons. That's when schools are out. That's when the school districts and all these schools had excess food that they were willing to donate. So we started using Yellow Cab. Their drivers are Department of Justice screened. They can go onto a school campus. The drivers do not touch the food. The nutrition staff at the school comes out, loads up the food in these thermal containers, puts it in the vehicle drives it 3 blocks to an after-school program where that pantry staff who is trained unloads the food. That's a logistics solution, and that's how we kind of augment what we do and how we get food around. Technology, as I mentioned, that platform, it's critical. How are we going to ask for funding? How are we going to try to demonstrate what we do if we don't have data? Prior to us, did anybody ever donate an old sofa to like a Goodwill or something? Okay, did you get a receipt and was it blank? It's creative writing. Well, how are we going to get someone to fund a program or see the value of it when the data is garbage? It just wasn't accurate. This allows us to actually track on 2 locations who's donating it and who's receiving it, and they weigh the product. We know exactly how many pounds. How many pounds are we diverting from the landfills? How many pounds are we keeping from throwing away? That was the critical component. Let's jump over to the other side, food insecurity. As Doc mentioned, food insecurity screening was huge. And like Laura Lee, that was critical to me. For a doctor like Dr. Handler, it was important because they knew who was food insecure. School nurses knew who was food insecure. They had no course of action. Until that person became symptomatic, they had nothing they could do about it. The pantry map allowed us to give those doctors, those medical care providers, a solution. Here is a source for nutritious food that will help you. And it was a course of action that could be done that was didn't involve a prescription. There was no cost associated with it, but it was a tangible solution. This insecurity screening questions typically best handled in the privacy of an examining room. So for example, Laura Lee asked that question, how do we know if that number is accurate? Because we're asking these students in their health checkup when they go to the, into the university, or it's now on every college campus. And in the privacy of an examining room, people will give an honest answer. And they'll tell you, well, and food insecurity, just to define it for you, know exactly what we're talking about. It may not mean missing a meal completely. It just means that that college student who has a credit card that their parents provide for them, and when it runs out, they're out of food. So they are going to the convenience store and getting chips and salsa, and that's their meal, or top ramen, something that's not healthy, that does affect their overall health. That's a big part of it. More importantly, we found that, and I was one of the ignorant ones. I mean, I was the first to admit I was so ashamed of myself because I'm in the food industry, and I didn't realize that many of the people I employ are food insecure. That's why they get jobs in the restaurant industry. Yet I couldn't identify them. Just as Dr. Handler mentioned as he opened this, do you know who the homeless people are? I thought I knew who the hungry people were too, and I was totally wrong. We have no way of knowing who they are. Many of them are seniors. Many people came here in Orange County in the 50s and 60s. They built a life, they have a house, they retired, and guess what? Luckily, our life expectancy has dramatically risen, and we've outlived our money. My mom ran out of money 4 months ago. Did a reverse mortgage, did everything we could, but we never expected her to live to be 91 years old. And what happens is many of these seniors, they find themselves eating the items that are part of the emergency food kits that we get through food banks, which is typically always non-perishable food. So you're getting canned goods, you're getting shelf-stable, and what do all those food items have? Yell it out. Salt, sodium. They all have sodium as a preservative. I am 57, so I'm technically a senior, and I can tell you I'm not supposed to have sodium. Yet if I'm hungry and I'm going to eat a can of green beans and I'm going to have something in a package, I'm making that decision and having to weigh, am I going to go hungry and not have anything, or am I going to sustain myself with something that's going to lead to other health problems like ulcerated legs, hypertension, etc. So that's the advantage of food insecurity screening. We can identify who these people are. Our role is to provide, through that map, we know where the food supply is, where the nutritious food supply, and we can refer these patients to these pantries. Let me explain one other thing about pantries. They operate at all different times of days, months. So for example, or days of the month, some will operate on just one Tuesday night a month, some will operate every Wednesday, some will operate only in the daytime. It's really hard to determine when there's food available at these pantries. What we do is help to provide. We map it, and as a referral service, we can send them to these pantries and almost kind of come up with a plan where if you are out of food that day, these are your options, this is where you can go. The next item on there is the reduced healthcare costs. So again, like Laura Lee, I don't believe it. I want to see what the net effect is. So through UCI Emergency, we started tracking patients that were screened positive for food insecurity. We got them sent to pantries that had nutritious food based around their dietary needs, but more importantly, we wanted to track what was the effect on their health. So in subsequent visits, what was the effect on their high blood pressure? What was the effect on their diabetes?
Don't show the next slide.
Okay.
Don't show the next slide. Just to jump in, $165 billion are spent on healthcare for those people that are food insecure per year.
Billion.
Billion. $165 billion are spent on people who are food insecure and their health problems. Now, Laura Lee may say, where'd you get that data? And we have the data. Imagine the healthcare costs. Now, before we go to the next slide, remember this all started from a conversation with two questions? Now, you may go, Dr. Handler, you're the public health officer. You got the power to wield the things. I can bring people into the room. I can't safety belt them in the seat. If they don't want to come back again, they're not going to come back. But what we did is we found a group of dedicated, passionate people who wanted to change the world, who wanted to impact hunger in the county. So, if I'm not mistaken, hold on one second. Give me a second. The numbers, is the next one the numbers? Look at this. Oh, I thought I changed it. I did change it. It's 56 million pounds, not billion. They had the wrong PowerPoint. It's 56 million pounds of food that's been recovered since we started Waste Not OC.
That's subliminal.
Yeah. And 168,000 families were screened for food insecurity. That's pretty powerful, isn't it? Next slide.
And that's just in Orange County.
Well, we'll save that. It's a good question.
Where do you recover this food?
Where do you recover?
Great question. We work with any entity that is licensed or permitted to handle food because we know it's safe. We know they've been trained on how to handle food. So it's restaurants, grocery stores, hotels, caterers, more importantly, farmers, growers, distributors, food processors, and manufacturers.
Okay, Mike. They ask, how can these lovely people here who came to hear a talk on social determinants of health, how can they make a difference in the county?
The opportunity to volunteer your time is critical. Yes, money is helpful, but I've always found that resources are more valuable in many cases than money. And that is, when we look at logistics, yes, we have food service companies, produce companies, distributors, whose trucks go out full and then they come back empty. They'll oftentimes make pickup runs for us. But what we really use are volunteers. It's a great opportunity. How many here know how to use a phone app? Smartphone app? Most. 10 years ago, I wouldn't even be raising my hand. But the ability to sign up as a volunteer using a phone app means that when you have time, when you're bored, you can, on the app, you just log in as being active. And if there is a food run, it'll come to you, meaning the BJ's Pizzeria down the street has food to pick up and they want to take it to the senior center. Can you make that run? It's that simple. We provide you with basic food handling training, how to handle and store food correctly. We'll provide you with a thermal bag. It doesn't take up space. It's less space than a blanket. And then also a thermometer. So we are going to track the time and temperature And those are the two critical components of food safety, time and temperature. But that's how we can, everybody here, if you have time, you can go to wastenotoc.org. You can go to how to get involved, and you can sign up as a volunteer. There's a little homework, though. There's going to be modules on food safety. In other words, what do you need to know to safely get food from point A to point B? And then you're going to take a quick 25-question quiz. And if you get 23 of those 25 questions right, we're pretty confident you know how to handle food. And you are now active as a volunteer. That's how all of us can help out. But more importantly, one of the things we do in multiple areas, because this model is now being advanced all around the country. It's being adopted in Mississippi, Minnesota, Ohio, Texas, up and down the state of California. It's an effective model because it gets to root causes and it has outcomes, real data. It's not trust me. But what we really need is to look at, maybe some of you here are probably retired. Maybe you did something for a living for many years that would benefit us. Our board president for Waste Not OC is retired. He's a former supply chain and logistics executive. The guy wrote the book on supply chain and logistics for national food companies and international companies. And when we ran into him, he was kind of bored, wanted to do something. And he's brilliant. So sometimes it's what you've done, your past experiences. Sometimes it's connections. It's, so much of this is relationship based, and it's someone that you know who can help us out, like Yellow Cab, for example. So it's very simple to volunteer. We'd love to have that kind of help. It's critical to the program, and again, it's at your convenience. And then the last thing I would add to that is, the other way of volunteering is sometimes identify a pantry that you want to work with, that's near and dear to your heart. Maybe it's a Boys and Girls Club. Maybe it's just going to the food bank and sorting through food that's donated. There's so many different ways that you can participate. But the one thing we know for sure, Dr. Handler mentioned homelessness. If you mention education, you mention all these things that are those root causes of poverty. The one thing that is universal in that is we all have to eat, and that's what we have to do most often. Food is at the root of all of this. So much like the homelessness issue, if we get food to where the homeless people are, we're sustaining them for another day. But if we can get them to where the food is at, and along with that food, we have services like mental health counseling, drug treatment counseling, financial planning, transportation solutions. Now we're using food to get at those root causes and to improve their life and get them out of the cycle of poverty where they need to have help. It's the old saying, let's get them a hand up instead of a hand out. Thank you.
Keep that. So, Mike Leorakis, how long have you been the executive director?
3 years.
3 years. He has done a remarkable job. Let's give him a hand.
Thank you.
Come on. No. We're not done with you.
I
think he's really suave, debonair. I want to share that there's almost every day that Mike and I, working on this project, it's been absolutely magical. People come up to us and say, we do this, we could help you with this. Do you need this? We've got that. But I want to share one thing with you. Mike is an incredible athlete and an incredible golfer. And I just want to share a magical moment that he had when we were meeting with one of the executives from CVS, because we wanted CVS to adopt a pantry, and instead of throwing away their things, giving it to a pantry. So we were on the golf course doing business. Go ahead, Mike.
I'm going to preface that by saying I had never been on this golf course before. I was probably on medication.
Oh my gosh, what an excuse.
We're on the last hole, and I take the wrong club out of my bag, and I hit a ball in the parking lot. And I hear a crash. So we go in the parking lot, and there's my ball sitting on the top of a brand new Audi and the smashed window. So I go in the clubhouse, the pro shop, and I make a copy of my driver's license, and I leave it on the windshield. This is the 3rd of July. Happy holiday. And I get a call maybe 4 or 5 days later. I thought I skated by this, But I get a call 4 or 5 days later from a gentleman that goes, yes, we met through my windshield. So he informs me the club has insurance. If I can just cover the deductible, it'd all be good. So I send him a check for $200. And I get a phone call back from him. Mike, I know you. I know your restaurant. I eat at your restaurant all the time. And I go, oh, I'm sorry, I didn't recognize your name. Well, it turns out he is the president and CEO of the country's largest food brokerage company. And then he became a partner, and then he became a supplier. Now all of the brands that they represent started participating in food donation. And that's where that 56 million pounds came from. There's still so much more of it. But again, people have come in and out of this project over the years that you just shake your head and say it's just divine intervention or karma or something, but we couldn't draw that up.
Thank you, Mike. So we're going to start winding down, but I want to give you a gift. I got a gift for you. All right? You don't believe me, do you? This is a free app that you can download onto your computer or onto your phone. And it's called Food Keeper. It tells you how long food is good for. Eggs, tuna fish, milk. It's a free app. It's through the federal government, and it's wonderful. Don't say I never gave you anything, because I have. All right. So remember they said acts of kindness, one person caring. I'm going to show you one last video, and then we'll open it up for questions. This video is extremely short, extremely powerful, and it's true. So when you watch the actors in this video, at the end, they will show you the actual people who were involved in this. So can we turn the lights down, please? Acts of kindness.
ออกมานี่เลยนะไอ้ขี้ขโมยไหนดูสิเอาอะไรไปออกมานี่เอาไปทำอะไรเนี่ยฮะถามว่าเอาไปทำอะไรเอาไว้ให้แม่เจ๊แป๊บนึง
แม่ป่วยเหรอ
อย่าทำอย่างนี้อีกนะ
หมวยเกาเหลาจ๋อนั่งเลยครับนั่งเลย
ป๊า
จัดไปอ้าวสั่งมาเร็วต่ออะไร
So, before we open it up for questions, I want to leave you with one last quote. And it goes as follows. I call it the Don Quixote principle. Remember my boss patting me on the shoulder, saying, "You're going to end hunger, good luck." So many dreams at first seem impossible, and then they seem improbable. And then, when we summon the will, they soon become inevitable. Thank you. So, Laura, I guess we do this question answer. Hey, Mike, you want to come up here? Come on up, Mike.
I commend you for starting this project. I've always wondered why there was so much wasted food from supermarkets, restaurants, etc. We've seen people going into dumpsters to collect things. That's not good. There's always been so much waste. Here in the village, they have collections for South County Outreach, and one of the classes I take does so too, and the senior centers feed people. I am not a hands-on person, but I do give money, and I encourage other people to do so too. But I think it's wonderful that you've organized this and finally something is really being done.
Well, thank you. Appreciate that. Any other questions? Yes, go ahead.
Yes. I'm from back east, and
I'm sorry.
Anyway, when we had people who needed food, they were only allowed to go to the pantries once every 3 months. So I'm wondering if there's a limitation on how often families can go, and or how much they can get, or something like that.
It varies by pantry. Some pantries will have a limit as to how many times you can go through. Some of the school pantries, for example, at Orange Coast College, they can go through once a week, but they can take, I believe, up to one bag, so it's enough food to last them for a week. So it varies by pantry. One of the things our pantry map provides is some of those restrictions and limitations.
My question is regarding quality. At the very beginning, how do you determine quality, and how is that decision made?
Of the quality of the food?
Yes.
That's a great question. Great question. It has to be edible food. But what we found when we started this is we could recover. You saw the numbers. We could recover the food. What we couldn't do is maintain it. In other words, most of this food is end of life. So a lot of times what we'll do is we'll take this product, this food that's been donated, and we will repurpose it. So we've developed a network of food recovery kitchens, and they will take all this different product, produce from farmer's market, along with turkey from a distributor, and they will make a turkey stew out of it. But the quality, first of all, the food has to be safe, and we explain to donors that the federal liability protection only extends to you if you are certain that that food is healthy or safe and nutritious. In other words, if you are donating something because you want the tax deduction and it's not edible, your liability protection is stripped, and now you're really risking your brand.
Okay, next question.
I wonder if it would be possible to go to local restaurants that we eat at and ask if they contribute to this. And if they don't, how to get them to you.
Yes, that is huge. Absolutely huge. We go to trade organizations, service organizations. People always will also ask, and I say, look, as a restaurateur, I had nothing gluten-free that I knew of in my restaurant 10 years ago. You know, if someone asked for it, I felt bad. They had celiac. But the public is what I answer to. When someone wants to come and talk to me, if they're a customer, they get my undying attention. So that is the absolute time to ask them if they donate their excess edible food. In fact, I will be more than happy to send to you. We have bifold cards that you can drop off. But again, there's a cost benefit to that restaurant. So you're doing them a favor, and you're directing them to where they have resources.
We can't hear you.
She asked if I could explain about the cost benefits.
Okay.
The cost benefits to restaurants are that when I started donating food, I realized, because I'm in bed when my restaurant closes, how much food I was throwing away. It allowed me to make production changes. I don't make as much food, I buy food differently. All 700 plus of our donors around Orange County have all said the same thing. It allowed them to reduce their overall food costs. It went right to their bottom line. That's first and foremost. Secondly, I get a tax deduction on what I'm donating instead of paying the waste hauler to remove it. And third, those millennial employees that I don't understand and they baffle me, they love this and they don't leave. They stay, they are committed, they think we're changing the world, and in some way we are, and that's the third benefit.
I worked at a food bank for 3 years in Phoenix, Arizona, and our biggest donor was the Bashers' food chain store, and schools. School children used to bring in food to us. And also, the interesting that people say is when they come in, the stories that you find are unbelievable, that they look like they're fine and they look like they have a nice car, but the background story breaks your heart. But it's a wonderful, wonderful thing to do.
You know what? I'm so glad you brought that up. I have two real quick stories. One was a department head for a city here in Orange County who contacted us after we spoke with her. She stood up in front of all her contemporaries and said, hey, we need to support this because I was food insecure. I know what it's like. We need to do this. The next year we met with her, again in that same group, and she takes me out to the parking lot and she says, I'm still food insecure. You know, I'm trying to raise 3 kids as a single mom. I live in the city in South Orange County that I work. I can't go to a shelter because if they see me there, I'll lose my job. Just last week, I spoke to a gentleman who owns a mortgage company. He's a funder, a lender, and he teared up and broke down, telling me how he had $11 million in the bank, and when the economy crashed 10 years ago, he lost everything, had to sell his house, but he kept the Mercedes because he goes, with what I do for a living, I can't drive a Toyota Camry. Yet he was going to pantries because, you know, he had 3 daughters and he had to feed them. So you're absolutely right. We just don't know who's food insecure.
Listen.
I own Catella Grill, which is in the city of Orange near Angel Stadium and Honda Center.
And we only had to shut it down twice.
Yeah.
Oh, sorry about that.
The question I have is, do the university dining halls donate?
Yes, they are donating now. Universities now, especially UCI, has probably the best program in the country now. Not only are they doing sustainable farming on the campus, but they're also reducing their waste. The community colleges are tremendous at it. In fact, Orange Coast College has kind of led the way because they have a culinary program. We've provided equipment for them to work as a repurposing kitchen. So product goes to the pantry, and it's in vacuum packaged containers, so it extends the shelf life a couple weeks. The colleges and universities have got it dialed in now.
So just so you know, when we started this program, Waste Not Our Communities, we approached UCI because we noticed on the Google map that there were no pantries near the campus, and we know there's food insecurity. So we said to the administrators, we would like to survey your students to see how many are food insecure. What do you think they said? Are you kidding? Could you see as a recruitment flyer, we have 1 out of 5 students that are food insecure at UCI. Come on down. So working with administrators from UCI, for a year, we were unable to get a pantry on campus. It occurred and finally happened when there was change in the chancellor. It requires internal champions within an institution to make things happen. We were trying to get every child at Children's Hospital of Orange County screened for food insecurity. A year I worked on it. Couldn't happen. It wouldn't happen. Then I met an internal champion. He looked at me and he said, give me 3 weeks. And sure enough, 3 weeks later, they were screening people that they were seeing for food insecurity. So we were able to meet every challenge and every hurdle. And the reason we were able to do that is because of people like Mike and others that are passionate and dedicated. Okay, we can take one more question that was told.
I worked for the Ashland Food Bank, Ashland, Oregon, and we had a program where we canvassed every single neighborhood, bringing green bags with us, asking for donations every other month. We left them with schedules, and so I can't tell you how many people cooperated. So we had people on every few blocks that were responsible every 2 months to go pick up all these green bags. And it gave everybody the opportunity to help.
That's a great way, that's a great program. And it's interesting because we look at residential, food that we can do from our homes, but the reality is, in the United States, 40% of the food that we grow and produce and process ends up going into the landfill. So it's for on the commercial side of it, where the big numbers are in terms of the amount of food, it's changing the way we do things, so that we buy differently and that we handle food differently.
Sir, I have one question. At the start of your presentation,
Wait, where are you?
I'm right here. At the start of your presentation, you were talking about the amount of money a person here in Orange County would have to earn to be able to afford rent. And I think what the issue goes down to, the foundation of the problem is it's hard to live in this county, in this whole country, because you need a lot of money. One way to solve the problem would be to raise the minimum wage and require everybody to pay that. That way, everybody in society is paying for the cost, because obviously things are going to cost more, but I think that's the only fair way to do it, raise a living minimum wage.
I'd like to answer that. As a restaurant operator, I can tell you what my staff has gone through. The reality is that when minimum wage goes up, and I've had state senators explain to me the reason for raising minimum wage, it's because I, as a restaurant owner, am going to have higher costs, and I'm going to pass those costs along through higher menu prices, and there's one common denominator: sales tax revenue goes up. But unfortunately, when we raise minimum wage, it's not in proportion. So I always use the example, I'm glad you asked that question, because if you'll indulge me for a minute, I'll take a little container of strawberry jam, and I'll explain. The farmer who now has his labor cost goes up, they add that onto the cost of the strawberry, and then they go a little higher. And then it goes to the processor who processes that into a jam. They increase to cover their costs, and then they go a little higher. And then it goes to the distributor who drives it to my restaurant. They add their costs, they go a little bit higher. By the time it gets to me, I can't even cover the cost of it. But more importantly, that same principle, if you look at gardeners, pools, maintenance, all these costs go up, and now the people we're trying to help who are paying rent at an apartment, that's why their rents have skyrocketed, because of the cost. So I think it's a balance of, I have someone, actually I have no one in my restaurant that makes minimum wage, but if I have somebody who's making minimum wage or on that lower level, I don't want them to be with us forever. I want them to move on, to be able to make more money somewhere else, to do something greater. And that's why these food recovery kitchens are great, because we provide culinary skills training for at-risk youth, for people who are having trouble re-entering the workforce. The reality is that if I'm hiring a cook in my restaurant, that's at least $17, $18 an hour right now. If you're in the Disney area, it's $25 an hour. But these are opportunities that branch out into so many other occupations that are high-paying jobs in sales and marketing and risk management, et cetera. So I appreciate the question. I think really what we get to is that root cause of how do we control the cost, and how do we empower people to be able to be more successful through education and job training.
And affordable housing. So, Laura, I think we're finished, and you've been a great audience. We give you a hand. Thank you. Here it is, here.
Thank you so much, Dr. Eric Handler. And thank you, Mike. Let's give a warm clap. Thank you so much. I've learned so much.
Thank you very much.
And so next week, we don't have class. We'll see you in 2 weeks for Dr. Carrie Burnite. Thank you, everyone.